Hello, everybody, and welcome back to another episode of Nursing Surgery, Day 5. Today, I, Haiqal from Group 26, will be your nurse, and I will explain to you about the natural urinary output that people have, as well as how do we collect the urine for us to measure the urinary output later. There will be 3 methods that I will be explaining to you. First will be the natural method, second will be the urinal method, third will be the bedpan method. However, as usual, before we begin demonstrating, we must first answer the frequently asked questions about today's topic. First and foremost, why do we collect urine in the first place? Isn't it something nasty? Well, there are actually many reasons why we would collect a patient's urine. First and foremost, we could check if the patient has a UTI, which is a urinary tract infection. Second, we can see if they have any STIs, which is a sexually transmitted infection such as chlamydia for men, which is something very dangerous. Next, in our case, we would like to know the natural urine output for our patient. Getting to know the natural urine output is something very helpful. This is because, for example, if the patient has a low urinary output, this could mean that they have problems with their kidneys, for example. So, getting the urine of our patients is something very helpful in treating the patient. Speaking about natural urinary output, this moves on to the second frequently asked question, which is, what is the natural urinary output? How much is it for a normal human being? Well, for an adult, the natural urinary output will be in a range between 800 milliliters to 2000 milliliters. But the caveat is, if and only if the patient has consumed 2000 milliliters of liquid, then only should they produce 800 to 2000 milliliters a day. That would be the normal range, because a typical human would drink ideally 1.5 liters of water to 2 liters of water a day. Next would be, when do we collect the urine for our patients? What time of the day? Well, we will collect the urine of our patient early in the morning, first thing in the morning, usually right after they wake up, or after the usual wake up time of 5 in the morning. And to calculate natural urinary output, we will have to keep collecting the urine specimens for every 4 hours. However, do not do the same mistake as I did when my lecturer asked, if the patient doesn't have any urine during the 4th hour, what do we do? Well, I answered, insert a catheter. My lecturer laughed because it was wrong. We do not do that, and it is inhumane to force someone to pee just because they couldn't or didn't want to pee. Essentially, we just have to let it be. The patient pees when they want to pee, and when they pee, their pee will be collected and will be sent to the lab later on. But our duty is to only collect the urine sample, which is ideally for every 4 hours, and it begins early in the morning. Now, let's get on with the demonstration. But first and foremost, we need to know the items that we need to use. The first item on the list would be sanitary gloves. For the purpose of protecting the bed, we will need a waterproof cover. Next up, we will need toilet paper. Furthermore, it is the all-important urine container. Okay, pause. Sorry for interrupting the list of instruments that we would need to use for the demonstration. But just for clarification purposes, this container is almost identical to a urine specimen container, considering it can uncap itself like this, and it's about the same shape, cylindrical in size. On a normal urine specimen container, it would be written there the name of the patient, the date on which the urine was collected, as well as a specific identification card. Usually in Malaysia, we would have written our own specific identification card given by the government. However, during the demonstration, I will be using this container just because of the volume. There is more volume to show a more exact representation for the volume of urine output that we should be collecting. But it opens up like this. So now, let's continue back with the instrument list.
Next up, we have the urinal or bottle. Usually, it would be bigger and longer to hold in more volume, but this is the only cup I have. And we do not forget the all-important bedpan that will be used to collect the urine from bedridden patients.
Now, let's begin the demonstration with the first method, which is the normal method, just by using the urine container itself as well as with our patient. Today, our patient will be Idris Elba, the man who's supposedly going to be the next James Bond. Hello there, Mr. Elba. My name is Haiqal, and I am your nurse for today. I was instructed to collect your urine. Will that be okay with you, and are you comfortable with that? Yeah, it's alright, mate. Just tell me what I need to do. Well, the instructions are you have to fill 2/3 of the cup, or even the whole way if you like to. Just don't overflow the cup. Understood then? 2/3 of the cup, or the whole way, and do not overflow. Do I do it in the toilet over there? Yeah, the toilet's over there. Very well then. Before you go, Mr. Elba, here's some tissues for you to wipe after you're done. Oh, thanks very much. I'll be going now. Alright, mate. Here's the piss. Well, thank you so much, Mr. Elba, for filling up the urine container. I will now go take this to count your natural urine output. Thank you for cooperating. It's a pleasure, mate. That was the first method on how to collect our patient's urine, which is the natural method, by having the patient to do it themselves. The second method that we are going to demonstrate today is the method that uses a urinal or a bottle. Good morning, Mr. Elba. I'm Haiqal, your nurse today, and I will be collecting your urine sample. Would that be okay? And are you comfortable with it?
Yeah, it's alright, mate. But I slipped on a banana yesterday and I can't stand up today.
It's not a problem if you cannot stand, Mr. Elba. It is fine. You can stay on the bed. I'll be using a urinal to collect your urine today. Okay, Mr. Elba. The first thing I will do is put you in a comfortable position for you to urinate. Now that Mr. Elba is in a comfortable position, I will now remove your blanket, Mr. Elba. It will feel more cold because the hospital is cold, but do tell me if you feel uncomfortable and we can find another solution. Once we have removed the blanket from our patient, Mr. Elba, we should be able to see his private part, because usually a patient would be wearing a hospital gown in these circumstances. Now, a patient would, under a lot of circumstances, like to do it themselves if they can hold the cup and pee in it without the aid of the nurse. However, there are circumstances where the patient cannot hold the cup for themselves. For example, if they broke an arm or for some reason they just can't reach down there, then the nurse has to do it. So, Mr. Elba, since I'll be doing it for you, I'll be telling you straightforward that this may feel a little bit weird and uncomfortable considering another person is doing it. But I must warn you, the cup is a little bit colder than what your body temperature is, and you will feel more cold once your private part enters the cup. Once the cup has been inserted, we would then close the blanket to give the patient privacy, and we would exit the patient's personal space and close the shutters. When the patient is done doing their business, we would then open the blanket once again to retrieve back the urinal. Mr. Elba, I will now open the blanket to retrieve the urinal. Now, if it was in a real world event, you would see the urinal being filled with urine. But In this circumstance, I wouldn't want to get my little sister's toys wet because she would get very angry. So then we remove the private part gently, not in a hurry, and place it back where it belongs. Now we have a urinal filled with urine to be counted for the natural urine output. We will put that aside, and we will then close the blanket once again on our patient and return him, in this case Mr. Elba, into his favorite position. You have now witnessed 2 out of 3 methods on how we can collect urine from our patients. The last method would be using the bedpan. Now, due to time constraints, I will show you the procedure beginning from where we change the position of the patient to allow them to have an easier experience while using the bedpan. But essentially, it is the same procedure where you knock on the door, explain who you are, what are you doing, and making sure that the patient is comfortable before we continue with the bedpan method to collect his or her urine. Okay, Mr. Elba, since we are going to be using the bedpan, first I will be removing your blanket, then I will be moving you into a lateral position to your left side so that we could put the bedpan easier under your butt. I will now begin by removing your blanket. Now, I will be using the blanket underneath to aid me into moving the patient into a laterally position to their left so that we will be using proper body mechanics as well as protect our own body. Now, Mr. Elba, I will be moving you to the left lateral side, and make sure your right arm could grab onto the railing if you feel that you are not being supported enough. Right then, I will be moving you to the left in the count of 3. 1, 2, 3. If this was a real patient, you would be looking at the butt area of the patient. At this part, you put a waterproof cover underneath the butt in case any leakage occurs. Now, Mr. Elba, I will move you back into your original position with the bedpan underneath your butt. It may feel more cold considering it will be made out of metal, but I will aid you in this transition of your position. Now, under normal circumstances, the bedpan wouldn't be this high because it will be very uncomfortable position, as well as the hip will be in an unnatural position. But this is a Tupperware at the end of the day. The next step for the nurse to do is to put back on the blanket onto the patient, give them privacy by leaving the room or their personal space, closing their curtains and letting them do their business, and come back once the patient calls you. When the patient has completed his or her business and has called you back, you would then need to tell the patient that, Mr. Elba, I will now move you back into the lateral position on your left as you were before the bedpan was placed underneath you, so that I could remove the bedpan without causing any injury towards you. Will that be fine? Now that the patient has been moved into a lateral position towards his left as he was just before the bedpan was placed, you will now collect the bedpan with the urine. Make sure to dispose of the waterproof cover properly. And now we can move the patient back into the supine position. Once Mr. Elba or any patient has been placed back into the original supine position in the beginning, we would then be providing perineal care and making sure that the private part or any surrounding parts of it are not wet and does not contain any traces of urine. Now that you have cleaned the perineal area, it is time for you to put the blanket back on and leave the patient to rest and recover. And that is all for today, ladies and gentlemen. You have learned the 3 ways for us to collect urine from our patients. First and foremost was the normal method. Second was using the urinal or even a bottle. And third is by using a bedpan. Now remember to share, like and subscribe on the video, as well as hit the bell so you will be notified whenever we upload. See you in the next episode.